Welcome. In this video, we'll explore a lung condition known as pleural thickening. We'll delve into its causes, how it develops, the symptoms it presents, and the methods used for diagnosis and treatment. Whether you're a medical professional, a concerned patient, or simply curious, this video aims to provide a comprehensive overview of pleural thickening. Pleural thickening occurs when the pleura, the thin membrane surrounding the lungs and lining the chest cavity, becomes abnormally thick. Several factors can contribute to this condition. The most common cause is exposure to asbestos, often leading to a specific type known as asbestos-related pleural thickening. Other causes include infections such as empyema or tuberculosis, injuries to the chest, complications from surgery, certain medications, and even conditions like rheumatoid arthritis or lupus. Sometimes, the cause remains unknown, referred to as idiopathic pleural thickening. Let's understand the mechanism behind pleural thickening. Normally, the pleura allows smooth lung movement during breathing. When inflammation or injury occurs, the pleura can respond by producing excess collagen and other substances. This leads to scarring and thickening of the pleural layers. This thickening can restrict lung expansion, impair gas exchange, and cause various respiratory symptoms. In some cases, fluid may accumulate within the pleural space along with the thickening, further complicating the situation. Pleural thickening is relatively common, particularly in individuals with a history of asbestos exposure. The prevalence varies depending on the population and the level of environmental exposure to asbestos. Occupational exposure, such as in construction or shipbuilding industries, significantly increases the risk. While asbestos-related pleural thickening is a major concern, other causes like infections can occur in diverse populations worldwide. Therefore, it's important to consider a range of potential causes depending on the individual's history and risk factors. The symptoms of pleural thickening can vary depending on the severity and extent of the condition. Many individuals may initially experience no symptoms at all, and the thickening is discovered incidentally during a chest X-ray or CT scan. When symptoms do arise, they often include shortness of breath, chest pain, particularly during breathing or coughing, and a dry cough. In some cases, significant thickening can lead to reduced lung capacity and decreased exercise tolerance. It's important to note that these symptoms can be similar to those of other respiratory conditions, making accurate diagnosis crucial. Diagnosing pleural thickening typically involves a combination of imaging studies and medical history. A chest X-ray is often the first step, revealing areas of thickening or calcification in the pleura. A CT scan provides a more detailed view, allowing doctors to assess the extent and location of the thickening. In some cases, a pleural biopsy may be necessary to obtain a tissue sample for examination under a microscope. This can help determine the underlying cause and rule out other conditions, such as malignancy. Pulmonary function tests can also assess lung capacity and airflow, helping to evaluate the impact of the thickening on lung function. Pleural thickening can be broadly classified based on its distribution, diffuse and localized. Diffuse pleural thickening involves widespread thickening of the pleura, often affecting a large area of the lung. It's commonly associated with asbestos exposure. Localized pleural thickening, on the other hand, is limited to a specific area of the pleura. It can result from localized infections, trauma, or prior surgeries. Another distinction is based on the presence of calcification, where calcium deposits are present within the thickened pleura. These classifications help guide treatment and management strategies. The treatment for pleural thickening depends on the underlying cause, the severity of symptoms, and the extent of the thickening. In many cases, particularly when the thickening is mild and asymptomatic, no specific treatment is required. Regular monitoring with imaging studies may be recommended to track any progression. For symptomatic individuals, management focuses on relieving symptoms and improving lung function. This may involve pain medication for chest pain, bronchodilators to open airways, and pulmonary rehabilitation to improve breathing techniques and exercise tolerance. In severe cases, surgery may be considered to remove the thickened pleura, a procedure known as pleurectomy, or to release the restriction on the lung, a procedure known as decortication. Preventing pleural thickening primarily involves reducing exposure to known risk factors, especially asbestos. Strict regulations and safety measures in industries that historically used asbestos have significantly reduced exposure rates. Individuals working in older buildings or industries with potential asbestos exposure should follow proper safety protocols and use protective equipment. Early detection and treatment of underlying infections and other conditions that can lead to pleural thickening are also important preventive measures. The prognosis for pleural thickening varies depending on the cause and severity of the condition. Asbestos-related pleural thickening, while not cancerous itself, can increase the risk of developing other asbestos related diseases such as mesothelioma. In many cases, pleural thickening remains stable and does not significantly impact quality of life. Recent research is exploring new diagnostic techniques, such as advanced imaging modalities, to better assess the extent and characteristics of pleural thickening. Additionally, research is ongoing to investigate potential therapies that can reduce inflammation and scarring in the pleura, potentially slowing or reversing the progression of the condition. Staying informed about these advances and working closely with your healthcare team are essential for managing pleural thickening effectively.